Hello and welcome. Welcome to the grand opening of the Behavioral Health Urgent Care Center in the City of Industry serving the San Gabriel Valley. You're going to hear a lot about the importance of this new program from a number of distinguished speakers, and that'll be followed by a tour where you will get an inside look at how this new program, which we call the BHUCC, will operate. I want to commend Los Angeles County for initiating this new program. It's really part of a trend nationally to develop crisis services that fill the gap between outpatient mental health treatment and acute psychiatric hospitalization. Individuals experiencing severe mental health symptoms, often for the first time, will be able to come to the BHUCC and spend up to 24 hours to resolve those issues and return home. That typically happens with linkage to ongoing mental health services and other services and supports they may need to maintain lasting stability. The urgent care centers are very effective in doing this. Across LA County, roughly 85% of patients are able to transition home. For the 15% or so that do need to go on to hospitalization, we of course arrange for that, including safe transportation. A little bit about us. STARS Behavioral Health Group is a statewide organization providing behavioral health services and other social services primarily to counties. In Los Angeles County, we go by the name StarView, and with 16 locations, we're one of LA County Department of Mental Health's largest contract providers. This is our second urgent care center. About 2 years ago, we opened one in Long Beach. And before the end of the year, one will open in Lancaster that we will operate. That is in a building currently being constructed by the county, and it will serve the Antelope Valley. I believe that will bring to a total of 9 urgent care centers across the county. All right, so let's move on. I will now introduce our first guest. Our first speaker is Congresswoman Grace Napolitano. The Congresswoman has represented California's 32nd District for over 20 years, and so really knows the needs of her constituents in the San Gabriel Valley and the communities she represents. She's also been a champion for mental health, so we're excited to hear her perspective from the federal level as well.
Hello and welcome. I am Congresswoman Grace Napolitano. I proudly served the San Gabriel Valley in Congress and co-chair the Congressional Mental Health Caucus along with my Republican colleague, John Katko of New York. Even though I cannot be there to celebrate with you in person, I wanted to say congratulations on the grand opening of the much-needed Behavioral Health Urgent Care Center called BHUCC in Industry, California. BHUCC will provide 24/7 rapid access to mental health assessment, crisis intervention, and medication support, helping fill a drastic need for mental health service in our community, which is very critical. Mental health still affects millions of Americans of all ages, genders, and races, and remains underfunded at every level and also very misunderstood. One population I am extremely concerned about is the individuals experiencing homelessness. The 2019 Greater LA Homeless Count report 4,479 individuals were experiencing homelessness in San Gabriel Valley. Of that group, more than a quarter self-reported a serious mental illness. Let's also not forget this pandemic is worsening an existing mental health crisis. We need to ensure we have a reliable workforce to be able to deliver life-saving services to all in need, regardless of zip code. Recognizing this, I reintroduced HR 2431, the Mental Health Professionals Workforce Shortage Loan Repayment Act of 2019, with my Mental Health Caucus co-chair, John Katko. The bill would expand mental health workforce by providing loan reimbursements to mental health professionals who commit to working in underserved areas. Our work continues but cannot be limited to Congress, and it's going to take a long while before we get traction. I encourage all to get involved. Educate yourselves and share resources with friends and with families. Contact your elected officials and let them know the problems that we have. If you see someone who has fallen on hard times, help them out, and if needed, refer them to mental health services. Together, we can continue to build a movement and eventually live in a world where there is no stigma. Congratulations again on opening a BHUCC. Very proud of you. And Mr. Larios, congratulations. Looking forward to seeing the life-saving work and services in person before too long. Stay well and be safe. God bless.
Thank you, Congresswoman. We really appreciate your leadership at the national level and your care and concern for your constituents across the San Gabriel Valley. I too want to give a shout out to Alfredo Larios. Mr. Larios is a former district chief for the Department of Mental Health representing the San Gabriel Valley area. Starview has worked with Alfredo over the past year and more to help outreach to the community, to let people know that the BHUCC was coming, and also to connect us with organizations and individuals who provide services and supports that our patients may need as they transition into the community. Thank you very much, Alfredo. Next, our speaker is Supervisor Hilda Solis, representing the 1st District, a member of the Los Angeles County Board of Supervisors. We're delighted to have her share her thoughts, and I want to commend Supervisor Solis and the entire board for their leadership in mental health. They have been completely supportive of developing a mental health system to meet the needs of the Los Angeles County population, and especially the safety net population that we work with, those insured by Medi-Cal, those are without insurance, immigrant populations. We're delighted to have her support and to hear from her.
Buenos dias. I'm very excited about the grand opening of the new Starview Behavioral Health Urgent Care right here in the San Gabriel Valley in the 1st District. Starview has been an amazing partner. They have provided wraparound services, crisis walk-in centers, prevention, and intensive service programs throughout Los Angeles County. We're fortunate to have dedicated doctors, nurses, and therapists working at Starview facilities. As supervisor for the 1st District of Los Angeles County, I know the importance of having mental health services that are accessible to families. The COVID-19 pandemic has exacerbated mental health disparities throughout Los Angeles County. During this COVID-19 pandemic, we have seen calls to our Los Angeles County Department of Mental Health helpline skyrocket. There's been a 40% increase in call volumes compared to this time last year, and we expect it to increase significantly in upcoming months. Too often, families resort to calling 911 when a loved one is going through a mental health crisis, which leads to a very crowded emergency rooms. The Behavioral Urgent Care Center will offer crisis stabilization and support to adolescents and adults. Individuals will be able to walk in when they are having a crisis. Our communities are strong and resilient, but I know that asking for help can be difficult. Our County Department of Mental Health is working closely with the UCLA Hispanic Neuropsychiatric Center of Excellence to reach more individuals in underserved communities. We know it's difficult to ask for help. We know families are struggling, which is why we're partnering with churches, faith-based organizations, and promotoras to ensure appropriate linkage to care. We are being creative in how we provide outreach. Starview Behavioral Health Care Center will provide immediate relief to families and individuals in distress. I'd like to thank Starview Behavioral Health, and I also want to thank the Director of the Department of Mental Health, Dr. John Sharon, and the entire treatment team here. I'm grateful Starview is here in the San Gabriel Valley, and I hope that we continue to take care of our mental health. Thank you and gracias.
Thank you, Supervisor Solis, and a big thank you to you and the entire Board of Supervisors for your ongoing support of mental health services, and especially the development of crisis services like the BHUCC. Our next speaker is Cory Moss, Mayor of the City of Industry.
Hello, my name is Cory Moss, and I am the mayor here in the City of Industry. On behalf of the City of Industry and my council colleagues and city staff, I would like to congratulate Starview Behavioral Health on the upcoming opening of their Behavioral Health Urgent Care Center located here in the City of Industry. The City of Industry has long been a supporter of mental health programs that provide resources to those in mental health crisis. I would like to thank our community partners who continue to advocate and support for mental health programs such as this one, particularly Congresswoman Grace Napolitano and Los Angeles County Supervisor Hilda Solis. We look forward to a long partnership with this facility that will help to enhance and work together with many of the programs that we have been supporting, not only here in the City of Industry, but throughout the San Gabriel Valley for years, So congratulations and welcome to the City of Industry.
Thank you, Mayor Moss, and a big thanks to your staff at the City of Industry. Building a secured facility and meeting the building and fire codes is a substantial undertaking, and we greatly appreciate the collaboration and support. Our next speaker is Brittany Weissman. Ms. Weissman is Chief Executive Officer of the National Alliance on Mental Illness of Los Angeles County. She also serves as a member of the Los Angeles County Mental Health Commission. In both capacities, she knows full well the importance of crisis services for individuals living with mental illness and their friends and family members.
Hi, good morning. This is Brittany Weissman. I'm the CEO of NAMI Greater Los Angeles County. I'm also appointed to the Mental Health Commission for LA County by County Supervisor Catherine Barger of the 5th District. And I'm delighted to help welcome you to the newest buck on the block, Starview Behavioral Health in the City of Industry. Welcome. We're glad to have you as a new community resource and asset. As you might know, mental health urgent care centers are a really vital part of the entire mental health landscape, especially in LA County. They provide a really great service in that they connect people in mental health crises with support, care, and follow-up as soon as possible. It's part of the early intervention effort that the county is trying to make happen in a more robust way. This buck will definitely help get NAMI members and their family members stabilized and connected up with services and supports for longer term care and coping over the long haul. And urgent care centers in general are one of the best alternatives in LA County for people experiencing mental health crises. They're comfortable, they're pleasant, as you can see from the pictures in this tour. This new buck is a very welcoming place, much more so than a general hospital, an emergency room. Much better to have someone receive services and support inside this buck than on the street as well. So we're really eager to spread the word that this is a new community resource. NAMI will begin referring our folks immediately after the doors open. And in addition to providing a full array of mental health professionals on site, Starview Behavioral Health is also offering family and peer support. And you can have someone sitting beside you who is a peer or a family member who can help you feel less alone and can help you understand what it was like when they were going through the process that you might be going through today. We're really grateful to have Starview to be able to refer folks to now. And part of why it's ideal is that you can walk yourself in. If you don't know where to go and you are at your wit's end, you can walk into Starview Behavioral Health's buck and the City of Industry. You can be dropped off by family members or friends or neighbors, colleagues even. And having this buck right off of the 60 freeway will mean a lot of things for our community. It means reduced homelessness. There will be a less exposure to the less ideal circumstances of a jail, hospital, street psychiatry. You'll be receiving care in a beautiful, more sedate setting that is much more conducive to your feeling better as soon as possible. I really do hope you enjoy this new community asset. It is bright and glimmering and welcoming, waiting for you. I welcome Starview Behavioral Health in the City of Industry to the San Gabriel Valley block, and I look forward to all the good you'll be doing here for our residents, our NAMI members, our relatives, and coworkers here in the San Gabriel Valley. Enjoy, and thank you for the opportunity to talk. Take care.
Thanks, Ms. Weissman. As you point out, peer staff with lived experience are so impactful in supporting mental health consumers in managing their recovery. And NAMI is so helpful for friends and families of individuals living with a mental health condition to help them support that individual. Thank you so much. Our next speaker is Lieutenant John Gannon from the Los Angeles County Sheriff's Department. Lieutenant Gannon is a team leader with a mental evaluation team. The MET teams combine a law enforcement officer and a mental health counselor to respond to individuals in mental health crisis. And we will expect many admissions to the buck will be referred by MET teams.
Hello, my name is John Gannon and I am the Sheriff's Mental Evaluation Team Commander from the Sheriff's Department. The purpose of this short video is to congratulate everybody involved in the grand opening of the Starview new Behavioral Health Urgent Care Center in the City of Industry. I greatly enjoyed working with the city staff and Mayor Moss dating back to 2014 when we first talked about bringing a training program to the City of Industry to help first responders and improve outcomes when they encounter people with developmental disabilities or mental illness. That work there in the City of Industry is ultimately what led to my interest in this current job. So it's very exciting to me to be in the near future heading back to the City of Industry to work side by side with you as your neighbor. Today, the MET teams have 33 regional teams, and if we get our continued support from the Board of Supervisors, we may eventually someday reach the minimum needs of the county of 60 teams. Our future growth plans include a brand new state-of-the-art mental health training facility right there in the City of Industry, hopefully later this year. From that site, we're also going to be deploying 4 MET teams on the PM shift and the graveyard or the overnight shifts on early mornings. And we'll be responding to crises in and around the San Gabriel Valley and South County from that location. So we're extremely grateful for the city's generous support and willingness to make that new training center and our office a reality later this fall. Industry is such an excellent location. It's well positioned and freeway close to virtually all parts of the San Gabriel Valley and what we consider our South County region down the 605 freeway. So this is part of the reason why we're so excited to see the BHUCC open close by. You can be sure that my team is going to come to know all your staff well, and we'll be working side by side and undoubtedly have many opportunities where we'll transport patients for stabilization treatment. But it's truly been something we've been urgently needing in the East County region. So we're truly thankful that this is finally going to happen. Currently, the closest urgent care center that we had to use was at LA County USC Medical Center, but that location is heavily impacted and it takes MET units out of the field for an hour or more in most cases. So having the BHUCC in Industry, it's going to save tremendous drive time. It'll keep units nearby so that when they clear from the urgent care center, they're close by to the next calls that they may be needed for, and that helps reduce our response times, and it helps us better serve the community, the caretakers, and the patients that are in so dire need of our assistance. So in a sense, please know that my team will become a close neighbor later this year. We look forward to that. And we'll be a great ally and an assistance, have a great relationship with our behavioral health urgent care facility in the city. And with that, I just want to send our well wishes on behalf of the MET team. Congratulations on your grand opening. We look forward to a very positive working relationship with the BHUCC, serving the most vulnerable population in the East San Gabriel Valley.
Thank you, Lieutenant Gannon. We look forward to collaborating strongly with the Sheriff's Department, the MET team, and to other law enforcement agencies across the San Gabriel Valley. Our final speaker is Dr. Jonathan Sharon, Director of the Department of Mental Health.
Hey everybody, John Sharon, the Director of Mental Health, coming to you by video. Of course, I would love to be with you in person, but this is a very special day. We've been waiting for some time to open a behavioral health urgent care center in the San Gabriel Valley in the City of Industry, and finally we're here. I want to thank Supervisor Solis in particular for her ongoing support of this department, of the field. I want to also recognize STARS, one of our really fantastic partners in delivering services and taking care of very, very sick people at the toughest times. Urgent cares are a big part of the solution to our communities. When people are facing tough challenges in short periods of time, we have to figure out a way to intervene, to provide stability and treatment, not always rely upon the emergency departments and the hospitals, and God forbid, the streets and the jails. So congratulations to you, to your community, to the County of Los Angeles on this momentous day. I'm very honored to be with you. Take care.
Thank you, Dr. Sharon. Your leadership in developing these crisis services across the county is so important. We want to commend you and the Board of Supervisors in those efforts. Thank you to all the speakers today. Let's move on now to our virtual tour.
During these challenging times, behavioral health services, especially crisis services, are more important than ever. So I'm really excited to give you a quick tour of our 9,000 square foot facility. The Behavioral Health Urgent Care Center, which we call the BHUCC, is located in the City of Industry. It's just off the 60 Pomona Freeway, but we will serve many people in crisis throughout the San Gabriel Valley. The facility is operated by Starview Behavioral Health on behalf of Los Angeles County Department of Mental Health. This center is meant to provide mental health consumers with intensive services needed when they're experiencing an escalation of symptoms to the point of a crisis. The principal goal of the BHUCC is to help consumers avoid hospitalization through stabilizing and returning to their homes. Continuing mental health services and other support services are arranged for those returning home to help assure ongoing stability. Some people liken the center to an urgent care center, almost like one they'd use for medical issues, but this is for mental health services. The total capacity of the BHUCC is 18 clients. Clients may stay up to 24 hours, and they'll be served by psychiatrists, nurse practitioners, therapists, case managers, peer counselors, and other specialists. For clients who are not able to stabilize within 24 hours and require hospitalization, transfer and transportation will be arranged. We also arrange for transportation home as needed for clients who have successfully stabilized. Let's go inside.
Those who come through these doors might come because they live with a mental health condition or they were referred by friends, family, or a community organization. We're available to anyone experiencing a psychiatric crisis who has a primary mental health diagnosis. Most of our clients will come through this entrance we call the Crisis Walk-In Center, or QUIC. This is the main entrance for voluntary clients, and it's open from 8 a.m. to 8 p.m. 365 days a year. Later, I will show you our second secured entrance for involuntary clients. The secured entrance can also be used by voluntary clients after hours when the QUIC is closed. Throughout our center, our overall objective is to treat patients with dignity and empower them in their recovery. We want to make their experience here safe and affirming. Part of keeping clients safe during the COVID outbreak includes temperature checks before they enter. We also supply masks and have the ability to space seating for social distancing. For everyone's safety, clients will also go through a metal detector upon entering the facility.
Part of the intake process takes place in the exam room, where the nursing staff provides a medical screening.
It's important that a client be medically cleared to be sure there are no underlying conditions that would make them unsafe in the facility. If the individual is admitted, a psychiatrist or psychiatric nurse practitioner will complete an assessment in person or via telehealth. They will develop a plan of care that may include services in the community or psychiatric hospitalizations. Those needing a higher level of care or psychiatric hospitalization will then be transitioned onto our secured units. Our mental health specialists will also conduct assessments to determine if the individual needs other services such as continued ongoing therapy, psychiatric care, case management services, and other services from a provider in the community. Those needing a higher level of care or psychiatric hospitalization would then be transitioned onto our secured units. Our mental health specialists will also conduct assessments to determine if the individual needs other services such as continued ongoing therapy, psychiatric care, case management services, and other services from a provider in the community.
Since we serve adolescents 13 to 17 and adults 18 and older, we have two separate units. This is the adult unit, which has the capacity to serve clients either voluntarily or involuntarily.
Voluntary clients will come through the QUIC and into this unit if they will need a longer period of time to stabilize during their psychiatric crisis. The mental health specialist will also do an assessment, providing therapeutic interventions, and they'll determine needed services and supports. Then a case manager or peer and family advocate will work with the client to link them to needed services and supports in the community. Here, clients can also relax in extra comfortable reclining chairs. There's also a kitchen where staff will heat up prepackaged meals or a snack for clients. The bathrooms on the secured units also have showers. If it is determined an individual will not stabilize within 24 hours, they will be transported by ambulance to a psychiatric hospital. Those who stabilize will be discharged and transportation will be arranged to return them to their community. Those who stabilize during the night may be discharged but will remain on the unit until the next morning if needed. This is the privacy room where clients wanting greater privacy in a safe environment can stay. And here in the group room, groups of patients can process issues together led by a therapist. Also prior to discharge, a client may meet with treatment staff and family members here.
Our facility has two entrances, one for daytime entry through the QUIC, and this one at the rear for after hours, law enforcement, and other public safety responders. We call this rear entrance our secured entrance. After 8 p.m., voluntary clients can enter the BHUCC through this adult and adolescent secured entrance. Clients will be served on a voluntary basis or for clients meeting criteria for 5150 or 5585 hold on an involuntary basis. A member of our safety specialist team will meet them here.
Members of the safety specialist team provide a smooth transition into our facility at the rear secured entrance. Our safety specialists, as well as the rest of the BHUCC staff, are especially trained in de-escalation techniques through a certification program called PROACT. If necessary, our safety specialists and staff can de-escalate clients upon arrival. In addition to working with the clients, our safety specialists also patrol our site 24 hours a day.
The transition from law enforcement to our center is quick and simple. Prior to the existence of urgent care centers, it was not unusual for law enforcement to spend 4 to 6 hours of their shift driving and escorting a mental health patient at a hospital ER. But now they can bring them here and be back working in the community within a short time.
The adolescent unit has similar functions to the adult unit, but it's for teens ages 13 to 17. It has a capacity to serve 6 teens at a time, and this can be on a voluntary or involuntary basis. Young adults who are negotiating the passage from adolescence to adulthood face incredibly difficult challenges, including depression, anxiety, homelessness, and substance abuse. And we are here to meet them where they are.
Whether we're treating adolescents or adults, the BHUCC is here to provide crisis mental health services. We're helping to alleviate impacted hospital emergency rooms that are not always equipped to deal with some of these issues. We're happy we can provide this much needed service in LA County.